You should believe in that. And yeah, I got really emotional, and I'm really happy that I came over here. I think I should control myself now, get back to technology. So as you heard, I'm a faculty member in the Division of Biomedical Engineering at Brigham and Women's Hospital at Harvard Medical School. And I'm interested to work in developing microtechnologies with applications in medicine and biology. So in this first slide, I just want to give you a brief introduction of the type of technologies that I have developed in the laboratory. If I want to categorize it in 3 sections, basically. First section is global health. I was interested in developing technologies for detecting of infectious diseases like HIV or peritonitis, which is the inflammation of peritoneal membrane in patients with end-stage renal disease. In another division, I was interested to develop microchip technologies for rare cell detection and sorting, including circulating tumor cells or HIV-infected CD4 cells. Also, I was interested to basically develop smartphone applications for medical purposes. For example, we developed a smartphone application at MIT Media Lab for improving HIV drug adherence in HIV patients, and we got an award for that. But today I'm going to focus on just one technology that, you know, Sultan was part of it. If you please go to the next slide, I'm going to talk about HIV. So HIV is a virus, right? And AIDS is the disease that this virus causes, and it's like one of the deadliest diseases on earth. So I'm sure most of you have heard about this disease, but probably you haven't heard about the numbers. So I'm going to tell you some statistics to really understand what kind of a devastating disease we're dealing with. So the number of people who are infected per day worldwide, based on WHO report, is 6,000 new infections per day. And that means like 2.2 million per year. You click, please. One more time. What is the name of this city? Punjab? Nagpur. You know, 2 million per year is equal to the population of Nagpur city. Can you imagine? Every year, one city as big as Nagpur get infected. It's crazy. Or if you look at the number of deaths, it's 4,000 per day, which is almost close to the population of Nagpur. So each year, that amount of people die because of AIDS. Or if you look at the children, that's like 500 per day, which is equal to the population of one elementary school per day, right? Sorry about this noise, guys. So this disease has killed 39 million people so far from 1983, when we realized about this infection, right? Right now we have 35 million HIV infected worldwide. So what is the problem? Do we have a cure for it? No. Do we have therapy? Yes. So we have drugs for controlling this disease. The problem is that, which is called antiretroviral therapy. The problem is that the treatment coverage is low, right? So we have a lot of infected people, but we don't know where they are because we cannot detect them, right? So the problem comes from diagnostics, because the current diagnostic devices that we have are expensive. or laboratory-based. A well-trained technician or doctor should run the test, and it takes sometimes minimum 2 days. So it's almost impossible to implement what we have in, let's say, USA in Africa, right? Would you please hit? So these are the number of aortic coverage. And that's, no. So that is an operating room. The picture on the very right is an operating room in South Sudan. So you can just imagine what kind of hospitals we're dealing with in the European countries. So the clinical need or problem is developing a point-of-care diagnostic tool for HIV detection, right? And we have different markers with CD4 count, viral load measurement, but viral load measurement is the most accurate and preferred method for HIV detection and treatment monitoring. So, okay. So this is what we thought. We thought, okay, how can we solve this problem? As I said, the technology should be really cheap, simple, fast. So we use the materials that are available everywhere in the world. Like what? Paper. Simple, like paper that we have. Paper is available everywhere. And printing technology is available everywhere, right? Everywhere on this planet, you have printing technology is a well-established technology. And electrical sensing is a sensitive technology for detection. Like diabetes meters is successful. And with electrical sensing, you can design technologies that are portable. Because if it is optical technology, then it has lenses, it becomes bulky, right? So electrical sensing, you can have small portable devices. So we print microelectrodes using printing technology. That is very simple. We can make the chips for just few pennies, right? So for example, this is one chip. This transparency paper, we print these electrodes on it. Or this is another chip. So the cost of this is less than few pennies, okay? And it is mass producible because we print it. Printing is really fast. And so the way that it works is that we capture viruses using antibodies. And then we lyse the viruses because we have charged molecules in the viruses. They come into the solution and it's going to change the electrical properties of the sample. So this might get a little bit technical, but I have to tell you, right? Just keep it in your mind. And then because the electrical property changes, we measure the resistance of the sample. So based on how many viruses you had in the sample, the electrical property changes accordingly. So that is our signal. So this is our invention. Nobody has done this. Nobody on this world. So that's how the technology works. We have intellectual property on this, and we can connect our reader to a cell phone just to transmit the data or test results to a central laboratory or a physician for counseling for further steps, right? So it makes it really attractive and very useful for developing countries for resource-limited settings. Okay, so these are, in this slide, I'm going to just give you some more details about the experimental results that we have got. So we tested the technology with multiple HIV subtypes. And the sensitivity of this technology is around 100 copies per milliliter, which is very good. It's comparable with the RT-qPCR, that is the gold standard method for viral load measurement. And we tested the specificity of the device. So when you develop any diagnostic technology, you have to check the sensitivity and specificity. These are the top questions people would ask, right? And so we successfully detected HIV in the presence of other type of viruses that like Epstein-Barr virus, Kaposi sarcoma, herpes virus in blood samples. And so the specificity is also acceptable. And so far we have validated the technology with 5 patient samples. The plan is to keep doing that until we get to like 200, 300 patient samples. And so the good thing about this technology is that this is a platform technology. It's not just for HIV. It can be adapted to detect other type of targets and viruses. And we have shown that by detecting Epstein-Barr virus and Kaposi sarcoma herpes virus in the samples. And there was a video, as you see, that's the way that we basically print these electrodes using a 3D printer. We can also print it using these regular printers. We just change the cartridge with conductive inks, like graphite ink or silver ink. Okay? Let's go to the next slide. So this is our team members. Basically, we had like 8 people involved. The top guys are I was the lead of the team, and then basically those are the clinical advisors who were the head of biomedical engineering and renal division and head of infectious diseases division, also assistant professor in the infectious diseases division. And we had like laboratory technicians, students like Sultan was involved in assay development and surface chemistry development of the technology. So the future plan is, as I said, we want to further validate the technology with more patient samples that is going to help us calculate the positive predictive value, negative predictive values that is important when we want to talk to FDA. And we want to do microchip optimization, like automation. These are the next steps. So as you probably heard, this technology was selected as one of the 3 finalists for this prestigious 2014 BWH Bright Future at Harvard Medical School. And we have gone through several peer review process. And basically, this is a short video that there is no voice. It's okay. So this is the video that the university basically created and then broadcasted internationally. Countries where 70 My name is Shafiee, and our team is working on developing a low-cost diagnostic tool for HIV management in developing countries. One of the major challenges in this battle against HIV is the lack of appropriate diagnostic tools for HIV management in developing countries, where 70% of the 35 million HIV infected individuals live. We have now invented an easy-to-use microchip technology that can measure HIV viral load within a few minutes. This handheld device can detect and count HIV viruses in a finger prick rod that is placed on a disposable paper with flexible electrodes. Microchips can be mass-produced because we are able to print microelectrodes on paper using conductive inks for just a few chemistry. And the device can be also potentially connected to a cell phone to transmit the data to central laboratories for detection for further cancer. This technology will have significant impact on the lives of millions of people around the world by providing time-sensitive HIV viral test results. So as I said, the last step is just based on, the winner is selected based on international public voting. And I would really appreciate it if you share this information with all your friends, family, and if you think that the technology is innovative, you can be part of this team by casting your vote. And your votes are really important. So for doing that, you just have to search for BWH Bright Futures Prize. To Google this BWH Bright Futures Prize, and then you're going to go to the website. There is a link for voting. You click on that and then select for Fighting HIV. There is just one project on HIV. The title is Fighting HIV/AIDS, a flexible, low-cost microchip. So I would really appreciate your support. In the end, I would like to thank the management of this trust and organization for inviting me and giving me this opportunity to give this talk, and I would like to especially thank Shafiee.